Welcome back to Midday Kentucky, everyone. We've been hearing the testimonies of Christina and Nikki, and they're here with Dr. Eric Smith from Georgetown Bariatrics and Advanced Surgical Services. We've seen your incredible before and after shots, ladies. Amazing.
Thank you.
I want everyone to know at home, Dr. Eric, in regards to insurance, because you both had it done on your insurance. This is gold, everyone. Dr. Smith, explain to us how that all works.
Well, the majority of our patients have insurance that covers the surgery, and every insurance is different. But we have an insurance coordinator that works just for us for bariatric surgery. That's her main job. She knows the system better than anybody. And so the very first thing that patients go through is they'll meet with her, and she'll check their insurance benefits, and not just if they have benefits, but what the requirements are for their specific insurance, and kind of what things they have to go through to have it approved.
Okay, so how long is that process? You go in for your initial seminar, I believe, ladies, is that the correct terminology? And then the next step, what's then?
That's our big initial intake appointment.
Right.
And that's when we're there all day, and we see, I believe that's when we see the psychiatrist that day. We speak with we speak with the nutritionist that day, and kind of get a feel of what we've been doing versus what we need to be doing.
And at this point, are you approved?
Yes.
To go to the next level?
Yes.
Okay,
Yes.
all right.
Yes.
And what relief did it feel like when you were told you were approved?
Oh, we were
wow.
ecstatic. We were so excited. It was a 6-month process with our insurance that they require prior to beginning the process at
Right.
Dr. Smith's office. So, during that time, we're required to lose a certain amount of weight as well.
Are you?
Yes.
I didn't realize that.
And every insurance is different.
Okay.
Some insurances
Yeah.
require a certain percentage or a certain number.
Right.
Some insurances just say you need to maintain your weight. But my thing on that is even if you're not required, if I see somebody in 6 months who now we're providing education and they know they're preparing for surgery and they come in and they've gone up 20 pounds, we're going to sit down. I don't care if they're going through insurance or they're paying self-pay. I'm going to say, look, we need to figure out why this happened. Because if we don't correct this problem, the tool that I'm giving you is not going to be effective.
Right.
Interesting.
Right.
I want to just bring up the video of this incredible robotic surgery that you do, Dr. Eric. Let's bring that up and you can explain to everyone what it is and why this machine is so crucial to your operations as well.
So, robotic surgery, I tell the patients, is just the most advanced minimally invasive surgery that we have currently. It takes the technology of laparoscopic surgery and just increases our ability to manipulate tissue, be much more precise, see better, handle tissue better. One quick example is, the movement of an instrument is completely steady. The force of a tremor is not strong enough to move the robot. So fortunately, I'm young enough that's not an issue right now, but
It's
one
quite
day
impressive.
maybe. Yeah.
It's really impressive.
Yeah.
So
Can I go on?
we do more robotic bariatric surgery than anybody in the state of Kentucky.
And that says a lot.
Yes.
I just want to
Yes.
share with everyone at home, because I think this is super important to know. Your life changed, you were approved by your insurance, and your copay, listen to this everyone, was $250. Your medical bills for your prescriptions were more than that amount.
Oh, yeah.
Correct.
A lot more.
So why wouldn't you want to have that next step in your life? When you heard that, what was the relief for you?
A tremendous amount of relief. I was shocked, for one, because I had no idea that it would even be that small.
Yeah.
And
So was I when you told me.
and that's a drop in the bucket compared to a healthier lifestyle and
Yes.
and a complete just whole new outlook on everything, mentally, physically, everything.
What do you say, Dr. Eric, for people sitting at home and they go, oh, this was always been out of my reach. This is something I could never do. What do you say?
It's one of the many assumptions that goes along with it.
Yeah.
Is, I think you've got to get information from people who have the appropriate information. And that goes from thinking it's a cop-out, thinking it's an easy way out, which it's not realizing that we're treating a disease just like you would with a medication, to getting people to understand that, look, it's not the misconception of it's too expensive or it's unsafe is just untrue. And that's when, if you come to a seminar, it's free. You can walk away from that and say, it's just not for me or I'm not ready.
Yeah.
But all that information can be provided to you in a free fashion so you know the truth behind how effective the surgery can be, how much weight you can expect to lose, what some of the medical problems that you have can be resolved.
Well, I think it's amazing. We're going to head over to break. If you want to find out more information about Georgetown Bariatrics and Advanced Surgical Services, there it all is up on the screen, everyone.